Hello and welcome to this course on monitoring and evaluation, or simply, M&E. I want you to think of today's session as laying down the concrete foundation for a strong building. In our case, the building is your understanding of M&E in the context of global health programs, development projects, and other large-scale interventions. If you've ever been part of a project, maybe a public health campaign, an educational program, or even a local community initiative, you've probably asked questions like, are we on track? Are we making a difference? And how do we actually prove it? Well, monitoring and evaluation is the structured, systematic way we answer those questions. 1. Introduction to monitoring and evaluation. Let's begin with the most basic question. What exactly is monitoring and evaluation? Monitoring is like taking the pulse of a project while it's still running. It's the continuous, routine process of collecting, measuring, and analyzing information to track progress towards set goals. Think of it as real-time feedback, the ongoing health check of a program. Evaluation, on the other hand, is more like the in-depth annual physical exam. It's the systematic assessment conducted at specific points, perhaps midterm or at the end of the project, to determine the relevance, efficiency, effectiveness, impact, and sustainability of the intervention. Put simply, monitoring tells you if you are doing things right. Evaluation tells you if you are doing the right things. 2. Distinguishing between monitoring and evaluation. Although they are closely related, there are some key differences between monitoring and evaluation. Timing: monitoring is continuous, evaluation happens at specific intervals. Purpose: monitoring is about progress tracking, evaluation is about assessing impact and making big-picture judgments. Scope: monitoring looks at activities and outputs, evaluation looks at outcomes and long-term effects. Think of it like driving a car. Monitoring is watching the speedometer, fuel gauge, and GPS while you're on the road. Evaluation is reviewing the entire trip afterwards. Did you choose the best route? Was it worth the cost? And did you reach the intended destination? 3. Why M&E is important. Now, let's address a question that's surprisingly common in practice. Why spend so much time and money on M&E? After all, shouldn't we just focus on implementing the program? Here's the truth. A program without effective M&E is like sailing without a compass. You may be moving, but in which direction? And at what cost? M&E is important because it supports decision-making. Managers use M&E data to make informed adjustments during implementation. Ensures accountability. Donors, governments, and communities want proof of results. Improves learning. It helps us understand what works and what doesn't. Strengthens resource allocation. Funds and manpower are directed toward activities that deliver results. Builds credibility. An organization that can show data-driven results is far more likely to earn trust and funding. 4. Monitoring best practices. For monitoring to be truly useful, it must be timely. Data must be collected often enough to allow course corrections. Relevant. Indicators should align directly with project objectives. Accurate. Errors in data collection undermine trust. Clear and simple. Overly complicated systems often fail in practice. Participatory. Involving stakeholders in monitoring increases buy-in. A tip for the field: don't collect data you don't plan to use. Too many programs waste resources on data hoarding without analysis. 5. M&E in the program cycle. A program cycle typically includes planning, implementation, monitoring, evaluation, learning and adaptation. Monitoring isn't just a mid-project activity, it starts in the planning phase and continues throughout. Evaluation then feeds back into planning for the next cycle. 6. Addressing concerns about evaluation. Common fears include: it's too expensive. But evaluations save money in the long run by showing what's worth continuing. It takes too much time. True, but without evaluation, time might be wasted on ineffective strategies. It might show failure. Yes, and that's the point. Failure is a learning opportunity. 7. Program theory and frameworks. To evaluate well, you need a clear program theory, the explanation of how and why a program is supposed to work. 3 common frameworks are Theory of change. Results framework. Logical framework, log frame. 8. The logic model. A logic model is a visual or structured representation of the relationships between inputs, resources, activities, what you do, outputs, immediate products, outcomes, short to medium-term effects, impact, long-term change. 5 main components: inputs, activities, outputs, outcomes, impact. Example, in a malaria prevention program. Inputs, funding, staff, mosquito nets. Activities, distribution of nets, health education. Outputs, number of households reached. Outcomes, reduction in malaria cases. Impact, improved public health in the community. 9. Developing outcomes and outputs. When creating outcomes, make them specific to the change you want to see. Ensure they are measurable. Link them directly to your program's impact. Outputs should be direct result of activities, quantifiable, time-bound. 10. The M&E plan. An M&E plan is a document that outlines what you will monitor and evaluate, how you will do it, who will do it, when and how often it will be done. It ensures consistency, guides the team, and facilitates accountability. Relationship between logic models and M&E plans. The logic model provides the map of your program, and the M&E plan describes how you measure your journey along that map. 11. Smart objectives. Objectives should be specific, measurable, achievable, relevant, time-bound. For example, reduce new HIV infections among youth aged 15 to 24 in Region X by 20% within 2 years. 12. Effective program indicators. Qualities of good indicators. Valid, accurately measures what it's supposed to. Reliable, produces consistent results over time. Precise, well-defined. Sensitive, detects changes over time. Feasible, can be measured with available resources. 13. Developing indicators and targets. Every indicator should have a numerator and denominator, where applicable. A target value, the level of performance you aim to achieve. A baseline value, the starting point for measurement. 14. The 6 steps of developing and implementing an M&E plan. Engage stakeholders. Review the program's goals and objectives. Develop a logic model. Choose indicators. Plan data collection and analysis. Implement, review, and adjust. At this point, we've set a very strong foundation for M&E. You understand the concepts, their importance, and how they connect to program success. In Module 2, we'll move from theory into practical application, data collection methods, analysis, visualization, and ethical considerations in M&E.